Hello everyone and welcome back to Dr. Deepa's Learning Launch. Today is the episode 4 of the podcast series and we are going to discuss a very important concept of general pathology, which is necrosis. This episode is designed to make this topic simple, visual and easy to remember. So let's begin. Let's first visualize necrosis. I want you to imagine a few clinical situations. A heart with a pale area of myocardial infarction, a brain filled with creamy pus, which is the brain abscess, a lymph node with a yellow-white cheesy center, like that of tuberculosis. Fourth, an artery with a bright pink ring around it, due to malignant hypertension. Fifth, a pancreas speckled with chalky white spots, due to acute pancreatitis. And finally, the blackened toes of a diabetic foot, which is a gangrene. All of these look different, they involve different organs and look like different diseases. But the underlying process is the same. This process is necrosis, which is an irreversible cell death in living tissue. Now let's understand each type of this necrosis. First is the coagulative necrosis. This is the most common and the most important type of necrosis. The best example is the myocardial infarction. So what happens here? The overall structure of the tissue remains visible. You can see the outline of the muscle, but the nuclei have disappeared and the cells appear like ghost cells. You can see this pattern in retinal infarcts and splenic infarcts also. Grossly, the tissue looks pale due to loss of blood supply. So remember, coagulative necrosis, the structure is preserved and the nuclei is gone. The next type is the liquefactive necrosis or colliquative necrosis, which is a melting tissue. Now think of the brain abscess. In the brain, the cells break down very quickly. Enzymes digest the tissues and turn it into a liquid mass. This is called liquefactive necrosis. What do you see in it? You see this kind of necrosis in brain infarcts, brain abscesses, and any condition that produces pus. So when you see pus, it means it's liquefactive type of necrosis. The third is caseous necrosis or cheesy necrosis. This is a classic necrosis of tuberculosis where the cut surface looks like crumbly cheese. Under the microscope, the structure is completely lost. You see an amorphous pink material surrounded by granulomas. So remember, caseous means cheese-like, which is seen in tuberculosis. The fourth type of necrosis is the fibrinoid necrosis or bright pink vessels. Now imagine the artery that is affected by malignant hypertension. The vessel looks bright pink and smudgy. This resembles fibrin. So that is why this pattern is called as a fibrinoid necrosis. So basically you see this in vasculitis, malignant hypertension, and immune complex mediated injury of the blood vessel. Here the blood vessel is damaged, swollen and narrowed. The fifth type of necrosis is fat necrosis or soap formation. In acute pancreatitis, the pancreatic enzymes escape into the fat tissues. These enzymes break down fat and form chalky white deposits by a process called saponification, literally which means soap formation. So this is commonly seen in omentum, mesentery and perinephric fat. Fat necrosis is almost pathognomonic of an acute pancreatitis. The sixth type of necrosis is the gangrenous necrosis. Gangrenous necrosis is seen in dead and infected tissue. Now think of the diabetic foot with black dry toes. This gangrene simply means coagulative necrosis with infection. There are three types of gangrene. First is the dry gangrene, which is common in diabetics and peripheral arterial disease. Wet gangrene, which is common in the intestine. And gas gangrene, that is caused by Clostridium, which is very dangerous. Black color is due to iron sulfide formed due to hemoglobin breakdown. As a mnemonic, the causes of gangrene can be remembered as a simple mnemonic: tips rested, TIPS, RESTED. So the T stands for trauma, I for infection, P for physical causes, S for special causes like Raynaud's phenomenon, embolism, syphilis, thromboangiitis obliterans, ergot poisoning, and diabetes. So this is a simple mnemonic for you to remember the causes of gangrene. No matter what the cause of gangrene may be, the nuclear changes of necrosis is the same. The nuclear changes includes pyknosis, karyorrhexis, and karyolysis. Pyknosis is where the nucleus shrinks. Karyorrhexis is where the nucleus breaks down into fragments. And karyolysis is when nucleus fades away completely. All these changes tells us that the cell death is irreversible. So as a quick summary to make necrosis super easy to revive, you have 3 C's, which is coagulative, co-liquative and caseous type of necrosis, 2 F's, which is fibrinoid and fat necrosis, and 1 G, which is gangrenous necrosis. So this, if you know these 6 types, then you will be able to write your answer on necrosis. Thank you for listening to today's episode. Hope you have a clear picture of necrosis. But the clinical relevance also is important. So if you found this useful, don't forget to follow, share and spread the learning. This is Dr. Deepa signing off today from Dr. Deepa's Learning Launch. See you in the next podcast.